In this video, we'll be going over 5 hypertension questions. I will read the question and give you a few seconds to think of what you remember. Then we'll read the 4 options and we'll discuss why the answer is best. This is just a surface review on hypertension. If you need more information, you can usually find that in your cardiac or vascular chapters of your nursing resources. Let's get started. Number 1. A client with rebound hypertension due to not refilling blood pressure medication on time is admitted to the hospital. Which clinical manifestations support this diagnosis? Select all that apply. Is it number 1, the client complains of increased shortness of breath when walking up the stairs? Number 2, the client wakes up with a headache? Number 3, the client is unable to remember what she ate for breakfast? And or number 4, the client complains of blurred vision. And the answers here are all of the above, 1, 2, 3, and 4. So in the question, we needed to be thinking about clinical manifestations. The thought is that signs and symptoms of hypertension are things like headache, dizziness, dyspnea, which is shortness of breath, activity intolerance, fatigue, nosebleeds, vision changes, buzzing in the ears, confusion, nausea, vomiting, chest pain, which is angina. So anything that related to those we could have picked. And if we did the true-false method, A is true, that goes along with the activity intolerance and dyspnea. Number 2 is true, they can complain of headaches, especially early in the morning. Number 3 is true, that can go along with the confusion issue. And number 4 is true, the vision issues. So all the answers are correct, and in the further learning, it's just also good to remember that hypertension can also be asymptomatic, but in this case, we are looking for symptoms. Question number 2. A nurse is preparing to take a blood pressure on a client who is obese. What is the most effective method for obtaining an accurate blood pressure reading from this client? Is it to number 1, obtain a cuff that covers the upper 1/3 of the client's arm? Number 2, position the cuff approximately 4 inches above the antecubital space. Number 3, use a cuff that is wide enough to cover the upper 2/3 of the client's arm. Number 4, identify the corticoff sounds and take a systolic reading at 10 millimeters mercury after the first sound. And the answer is number 3. So in this question, we are asked for the most effective method. We're not sure if it's talking about the actual skill of how to take the blood pressure or things like the answers mentioned, but we should have just been trying to think of what gives us an accurate blood pressure reading. And so in the further learning, there's a lot here, so it's a good one we would take a screenshot of. To obtain an accurate reading on any client, the blood pressure cuff should cover the upper 2/3 of the client's arm. It should be positioned 2 inches above the antecube space, not 4 inches. And it should be about 20% wider than the arm or the leg, because sometimes we can take blood pressure on the leg if we can't use the arms. If the cuff is too large, the blood pressure will be a false low, or if the cuff is too small, it'll give us a false high. And as far as the corticoff reading, the first sound that you hear is the top systolic reading, so you want to take that number right there. Even if there's a space between the first sound you hear and then the second sound, you always take that top reading as the systolic. And then you may have also been thinking, and it wouldn't have been wrong to think, it's just the answer didn't go that way, is that the proper way to take a blood pressure is to make sure the arm is at the level of the heart, the feet are flat on the floor. The patient should be sitting and waiting for about 5 minutes before you take the blood pressure, and make sure they haven't had any caffeine or nicotine 30 minutes prior. 3. Hypertension is known as the silent killer. This phrase is associated with the fact that hypertension often goes undetected until symptoms of other system failures occur. What referrals could the nurse expect that address the complications of hypertension? Select all that apply. Would you expect a referral to a nephrologist, a referral to a cardiologist, a referral to an ophthalmologist, or a referral to a podiatrist? And the answers here are number 1, 2, and 3. The referral should go along with the complications that we know that can happen with hypertension. And so the thought should have been that complications of hypertension could affect the heart, cause a heart attack or stroke or an aneurysm, an enlarged heart and heart failure. It can affect the kidneys. It can affect the eyes. It could lead to what's called metabolic syndrome. That's when there's hypertension and high cholesterol and a thicker waistline, as well as higher blood sugars. That's metabolic syndrome. It could also lead to changes in memory or understanding and dementia. So if we're thinking about that, the nephrologist makes sense, the cardiologist makes sense, and the ophthalmologist makes sense. The podiatrist does not make sense. That would be diabetes if you were thinking that. This is hypertension. So the answers were 1, 2, and 3. It's also a good idea to know in the further learning at the bottom of the slide, it's a good idea to know what tests might be run to assess for these complications. For example, the kidneys, you might be thinking of BUN and creatinine, as well as the nurse should probably check the urine output. The heart, maybe a chest x-ray, echocardiogram, eye exams, checking for glaucoma. All of that would make sense to looking for the complications of other systems that could be failing because of the high blood pressure. Question number 4. A client has her blood pressure elevated weekly for 1 month. At the end of the month, the nurse averages out the weekly blood pressure at 128/85 millimeters mercury. The client is 20 pounds overweight and her cholesterol is 240. What is the most important information for the nurse to include in the teaching plan for this client? Is it number 1, refer her to the doctor for further follow-up and medications? Number 2, decrease sodium in diet and begin a daily 30-minute workout 3 to 5 times a week. Number 3, reduce her potassium intake and decrease dietary fat. Number 4, check her blood pressure 3 times a week. The answer here is number 2. There is a lot going on in this question, and what's most important, according to Maslow, is to look for what could cause her the most harm. And it's that blood pressure going up that can cause her the most harm. She is considered elevated or pre-hypertensive. That is when the blood pressure is over 120/80. And so therefore, she needs to get on a plan that includes lifestyle changes. So if you look at the thought, things like low sodium, exercise, increase fiber, lower fat intake, limit alcohol, stop smoking, maintain optimum weight, control stress. If she does have diabetes and high cholesterol, we know she has high cholesterol, she needs to get that under control as well. And so yes, again, most important whenever you get a question like that is to consider what is physical fatal, and that is according to Maslow. Maslow's first level is physiological, which is the physical concerns for the patient. Why didn't we pick number 4? That sounds like a good one, and that is something we would put in her plan, but it's not most important. It's more important to treat her right now, not to monitor her. So the answer was number 2, and in the further learning, it's a good idea to know the different interventions for each blood pressure number. So lifestyle changes, which are the ones we mentioned, are recommended for the pre-hypertension or elevated numbers. The clients with stage 1. Stage 1 is now considered 130/80. Back in the day, it used to be considered 140/90, so make sure you're aware of those changes if you didn't know it. So 130/80 or higher, they're advised to start first-line medications. Examples would be diuretics, ACE inhibitors, or ARBs, or calcium channel blockers are good for African Americans. If they're stage 2, which is 140/90, greater than 140/90, that's when you might see a second medication added for control. Number 5, a client diagnosed with hypertension is being discharged from the hospital. The most important long-term goal for a client with hypertension would be to, is it number 1, learn how to avoid stress? Number 2, the patient will not be fatigued. Number 3, make a commitment to long-term therapy. Number 4, control high blood pressure. And the answer here is number 4. In the question, it's asking for a goal statement. Goals are not interventions. Goals are the outcome, like what do you want your patient to obtain? And it's also saying most important. So we also have to be thinking that most important means in relationship to what could be physically fatal for them. So in this case, the most important goal for this patient is that he simply controls his blood pressure. And therefore, if we look at the answer choices, number one is not a goal. It's how somebody controls their blood pressure, but it's not their goal. It's an intervention. Number two is a goal, but Maslow teaches us that physical fatal is first. Fatigue is not going to kill anybody. That's a good goal, but it's not the best one in my options. Again, number three looks good, but number three would be asking like a treatment for them or a way to take action with them, not a goal statement. And so number four is your answer. So in further learning, just really make sure to pay attention to what is being asked of you in the question and really try to think about your answer before looking. And then also, we said this, but remember the most important is according to Maslow, and Maslow's first level is physiological, which is physical. Physical fatal issues are always first, of course, when they're appropriate to the topic. Like, don't go down and pick a physical answer just because you see one in the options if it's not in relationship to the topic in the question. But in this case, it was. That's it. Hope you enjoyed critically thinking and learning through these questions about hypertension. If you want more videos like this, subscribe to our channel, and please don't forget to like this video. And you can always find us at sciencestrategies.com.